Good. Well, welcome everyone. Very happy to have you join here on this beautiful Friday afternoon. I'm Dr. Jacob Mirsky. I'm a resident here in Watertown and a primary care physician during my normal business hours usually, but I take a little bit of time every month for these Walk with a Doc um, presentations, which hopefully at some point will transition back into walking with a doc. But for now, happy to have you all on Zoom. And for those of you who are watching this recorded, thanks for checking us out. So today's topic is a general conversation or reflection on stress reduction. Part of the work that I do in addition to primary care is also focusing on thinking about strategies and practices that support better understanding what causes stress, and then also to develop tools and strategies to directly reduce stress levels. As I'll show a few slides here, and then I'll open up for conversation afterwards, because I can just keep on talking about this forever, but really happy to help out if there's any questions or concerns that you all have, generally speaking. But I'll start off with a slide here just to remind everyone that the framework that I use in my clinical practice and when thinking through ways of promoting healthy lifestyles is to use the framework or the guidelines from the American College of Lifestyle Medicine. So this is the United States branch of the lifestyle medicine movement around the world. And they emphasize 6 pillars, as they call it, of a healthy lifestyle. And what I want to emphasize here is that managing stress, developing strategies to manage stress, is one of the 6 pillars. And so it's really good to spend some time just to focus on that. But in addition, each of these other 6 pillars are also really effective strategies or areas of focus to think about bringing stress levels down as well. So many of us probably can remember from our more stressed days or less stressed days that being physically active for some people is a great way of bringing stress levels down. Eating healthy for many people can be a great way of bringing stress levels down. Avoiding harmful substances like alcohol, tobacco, drugs, sugar, caffeine can help bring stress levels down. Sleep is absolutely critical for a healthy relationship with stress, and then relationships themselves with other people that are healthy and positive and restorative are also great ways to lower stress levels. On the flip side, each of these pillars, when they're not tended to, when they are not a priority, when they fall by the wayside, can contribute to high levels of stress or can worsen high levels of stress that are already present. So for example, if someone is really stressed and doesn't make time to walk or get physical activity in, or eats junk food on the way between one appointment and the next, doesn't get enough sleep, and as a consequence drinks a lot of caffeine, and then when they crash in the afternoon eats a really sugary sweet treat to feel better, and then in doing so kind of neglects or doesn't tend to relationships, all of that can make stress worse. And so there's the flip side here, that on the one hand, focusing on these 6 pillars, each of them, including strategies for stress reduction, are really effective to bring stress levels down. But then also, if we don't tend to them, they can bring stress levels up. And the reason that it's so important to think about stress and managing stress levels is because when stress isn't tended to, it causes really serious impacts all throughout the body, mostly through chronic inflammation. So the big takeaway point here, as far as the science behind stress, is that chronic stress leads to chronic inflammation, and chronic inflammation then leads to chronic problems. And these chronic problems, we all know about them, and many of you probably experience them yourselves, which I'll show here, is that the many, many stressors that we experience, which we show here on the left, leads to the chronic stress response. And then as a result, we develop these chronic medical conditions, all of which are directly related to high stress levels: obesity, high weight, hypertension, high blood pressure, diabetes, high blood sugars, and then chronic pain, anxiety, depression, and other damaging behaviors. So it's really, really important to think through what are the ways to limit this stress response from going on and on and on and on and on. And then also, how can you counteract it? When we talk about limiting it and counteracting it, I like to think about this as a seesaw, as a balance. We all have many stressful things going on in our life. Maybe you relate to these four that I list here. Maybe they're different for you. And all of these weigh down or activate the stress response, and as a result, lead to those conditions that I just mentioned. On the other hand, there is this natural part of our body or a response in our body that's called the relaxation response, which is the opposite of the stress response. And the relaxation response is brought out when we do activities or practices or behaviors or hobbies that have some sort of repetitive nature to them and allow us to really be present to what's happening here and now. So that can include yoga, meditation, Tai Chi, cycling, swimming, running, even walking, crafts, cooking, anything where our attention is not on the future, on the past, but it's on the present moment, and where our mind can really attend to the present moment. For those of you who are thinking about developing a regular practice of something that brings out the relaxation response, I will just offer that there are a number of apps that you can find on your phone. Happy to answer questions about those apps as well and about practices. These are some of the more popular ones that I hear from my patients and I think are quite good. All of these have free content that's available. I don't have any financial affiliations with any of these. I think these happen to be very good, and I know that a lot of people do use them. So Headspace is one, 10% Happier is a second, Insight Timer is a third, and then Calm is the fourth. And in general, when you put all of these things together, becoming more aware of stress and when we experience high levels of stress, when we respond to the stress by bringing our stress levels down through either a breathing meditation or taking a walk, when we do all of that, that helps us to better engage with the stressors that we experience so that we can bring stress levels down. But then those other pillars of lifestyle medicine that I mentioned before are really critical at keeping stress levels down. Engaging in healthy relationships, getting a good night's sleep, eating healthy foods. And so this is the summary of how I think about stress reduction and strategies to bring stress levels down, is that at the core, we want to develop an awareness of when our stress levels are going up and then adapt to stressful situations in a way that brings them down. And then all of these circles or ovals on the outside are practices that can help support us sustaining low stress levels over time.